RNZ News at 1 o'clock. Kia ora, good afternoon, I'm Paul Brennan. The head of the Ministry of Health is holding a news conference shortly with an update on the response to the COVID-19 pandemic. We'll cross to that when he starts. Yesterday, Ashley Bloomfield announced 8 new cases of coronavirus, taking the country's total to 28. In the meantime, the Finance Minister says Air New Zealand would have been at real risk of failure without the $900 million loan from the Crown announced this morning. The funding will allow the airline to keep operating as it manages the implications of border restrictions and substantial reductions in travel demand. Grant Robertson says talks are also underway with Air New Zealand and other airlines to get the thousands of overseas New Zealanders back home. Auckland's libraries, pools and recreational centres will close for 2 weeks from today, in line with the government's recommendations to curb the spread of COVID-19. The Maritime Museum and Art Gallery and other council and convention spaces will also be closed. The Mayor, Phil Goff, says the decision was made with regret, but it's important and necessary. He says the decision will not affect the employment of any staff working at those facilities. The Restaurant Association says eateries are losing millions of dollars every week and expects the situation to worsen. The government has announced financial assistance for small businesses up to $150,000 if turnover has dropped by 30% or more. The Restaurant Association's chief executive, Marisa Bidwa, says eatery owners breathed a sigh of relief when the package was announced. She says about 200 restaurants are already on the brink of closure, and she expects that will worsen as public health measures become stricter.
Basically, it is lack of diners. People are slowing down, I guess, coming out, and for good reason. We're really trying to encourage New Zealanders to continue to support their local businesses. We think that's really important.
The Restaurant Association's chief executive, Marisa Bidwa. The SPCA is urging pet owners to come up with a plan for how their animals will be cared for if they're sick. It says ideally that would involve someone else caring for the pets. And the SPCA says there's no evidence pets can infect humans with COVID-19 and people should continue interacting with their pets as normal, but wash their hands thoroughly after touching them, their food, toys and bedding. In Christchurch, noise complaints about the police Eagle helicopter have skyrocketed in the last week. The 5-week trial of the helicopter in Christchurch ends today, and the region's top officer wants it to become a permanent feature in the city. Canterbury District Commander Superintendent John Price says in the first 4 weeks of the pilot, the Eagle responded to 305 requests for help and assisted with 210 arrests. Complaints to the City Council about the noise doubled this week to almost 80 by Wednesday. However, Mr Price says the noise complaints are low compared to complaints about dogs. And now
today, I have with me here today Steve Anderson, who's the Managing Director of Foodstuffs, and he's going to make some comments after I've finished, and they will help, I'm sure, round out the briefing for the day, and he will be available to take questions as well. So 11 new cases of COVID-19 in New Zealand have been confirmed in the past 24 hours, and that brings our total number of cases to 39. Where public health staff have fully investigated these cases, there is a clear link to overseas travel. In several other cases, the test results were only confirmed this morning, and these are still being followed up fully. Public health staff interview every case in detail so we can quickly identify all the close contacts and isolate them. Of these 11 new cases, 5 are in Auckland, 2 in the Waikato region, 2 in the Wellington region, and 1 each in Canterbury and Hawke's Bay. Details for each of the cases, including flight information where applicable, and it may not be applicable if the person's symptoms started more than 48 hours after they flew. Those details will be on the Ministry of Health website as soon as they are finalised. The website will continue to be updated as full information is received. None of the 11 new cases are in hospital, all are at home and self-isolating. One of the cases announced yesterday, a man in his 60s, is currently in Lakes District Hospital in Queenstown and his condition is stable. We continue to see an increasing number of cases and we are expecting more given the rapidly evolving situation overseas and the number of people who have travelled from overseas into New Zealand, including returning Kiwis, in the last week or two. We will continue to identify through testing and isolate to ensure we can stamp out COVID-19. We want to ensure New Zealand's health system is able to continue delivering high quality care to all New Zealanders who need health care at the moment, while we prepare to respond to any additional demands from COVID-19. In terms of those new cases, as in the past, Healthline will have details of the seat numbers of any relevant flights and will soon be able to advise anyone on those flights whether they are considered a close contact and therefore are required to go into isolation for 14 days. Of course, during that 14-day period, they are also monitored on a daily basis for any symptoms. Turning then to Logan Park High School, and as we reported later in the day yesterday, all the tests on 150 close contacts of the school student there were negative, and all 150 of those close contacts remain in self-isolation and will do so for the full 14-day period. The test results have given us some important information indicating quite clearly that the two Dunedin cases were linked to overseas travel rather than a possible community link, which we were on a precautionary basis wanting to rule out. Once cleaned and approved by local public health staff, the school is expected to reopen on Tuesday. We're coming up to the weekend, and for many people, either in self-isolation or getting used to a new way of life at the moment, because we have a ban on large gatherings, including any gatherings more than 100 indoors. And it's important to remember that self-isolation or not attending those gatherings does not mean social isolation. And you've heard me shift the language to physical distancing rather than social distancing. It's important for all of our mental well-being to stay connected to people, family, friends and colleagues. There are lots of ways to do this by reaching out by phone, social media of course, or through online contact. Talking to people and checking in on others not only helps us stay all connected, but it's good for our mental well-being. To slow the spread of COVID-19, as of yesterday, you would have heard the announcements yesterday afternoon, in addition to gatherings of 500 people or more in close proximity outdoors, there is an additional requirement that those with 100 people or more indoors are cancelled. This applies to both public events such as concerts, private events such as weddings and funerals. And we will all have to adapt to this new reality. However, this is very important that we do implement, collectively act on this expectation as part of our overall response to COVID-19. Organisers of gatherings of any size, even if they are within the limits, need to assess the risk they pose to attendees and to the community. Work, school and public transport are considered essential gatherings at this point and do not need to be cancelled or closed. There is very good information about this on the Ministry website, and we will keep that frequently updated, including with examples in response to questions we are getting. There's been some interest in how many people have recovered from COVID-19 who have had infections. We're looking at how we can collect and report on this information, and we'll make it available as soon as we can do so. Recovery from COVID-19 is a lot like recovering from a bad cold or from the flu. Anyone needs to rest, recuperate, keep up fluids and get lots of sleep. Probably good advice for general as well. Even when recovered, individuals may need to remain in strict isolation until cleared by their health provider, just to ensure there's no residual potential for infecting others. Finally, in terms of self-isolation, as of today we have set up a dedicated email address to access multi-agency assistance and advice where people need it. Through this email address, members of the public will be able to access information from health, immigration and police. Priority will be given to messages or inquiries from people who are confirmed cases or contacts of confirmed cases. And this will also enable notifications of reported breaches of self-isolation and mass gathering requirements. We ask people to use this channel judiciously. The address for that, the single email address for that is NHCC self-isolation, one word, NHCC self-isolation at health.govt.nz. So just before I hand over to Steve, this weekend people will be thinking, well, what should I be doing? First of all, looking after yourselves and your family and your friends, and reaching out to people, remain socially connected. Secondly, in terms of preparation, and Steve will talk about this, you may want to look at your supplies. However, there's no need to go above and beyond, and also think about the supplies of others who may not be able to get out, and ensure, please, that they are well catered for and looked after. So, Steve, I'd like to hand over to you just to talk a little bit about what the supermarkets are doing to ensure continuity of essential supplies.
Thank you. I'd like to acknowledge the great job that our government has been doing in managing the COVID-19 response, and also communicating to New Zealanders that by shopping normally, supermarkets can continue to meet New Zealanders' everyday grocery needs. So today, New World, Pack and Save, along with our competitors, Countdown, have jointly reached out to New Zealanders, asking them to shop normally so we can collectively continue to feed New Zealand. Rest assured, New Zealand, our supply chain is robust, and we will continue to meet our responsibilities and fulfil our promise to you. We are prepared, and while we are experiencing a run on demand, it is not a supply issue. Our supply chain is very robust. Our people are working tirelessly to move large volumes of product through the system to meet our customers' needs. And once again, we encourage New Zealanders to shop normally. The safety and well-being of our staff and customers are our top priority, and we're following health and safety protocols as advised by our health authorities. Once again, the supply chain is robust, but we are experiencing huge pressure right now. We don't have a supply issue, we have a demand issue. We're fortunate that many of our everyday grocery essentials are made or manufactured right here in New Zealand. Purchasing limits. There has been an increase in demand, in particularly long shelf life products. Customers might see some limits placed on products due to unexpected demands from time to time of those products. So rest assured, there are alternatives available, but so be creative. Our teams are working hard to replenish shelves to continue to meet customers' needs. We continue to encourage customers to shop normally. Our teams have everything in hand, and if we all purchase as usual, there will be no issues. Let's be kind to one another. These are unprecedented times, and shopping normally takes the pressure off our staff, who are working hard to ensure that customers get what they need. Our request is to be kind to our staff on the front line and also be kind to your fellow shoppers. We may all need to just take a deep breath or two collectively. Everybody is doing their best. So let's pull together, New Zealand. We're Kiwis, we know how to do this. So let's shop normal and let's be nice to each other. Thank you.
I just want to reiterate that point. Let's be nice, let's be kind. That's going to help us get through this extremely significant challenge. Happy to open up to questions
now. How confident there is no community spread? What's the risk at this moment?
So that's what we're looking out for very, very carefully. I should say any hint that we have, like the canary in the mind of community spread, would lead us to think about what other measures we need to put in place. But in a sense, and someone described it to me this morning, we want to ask the canary how they're feeling before they even feel unwell. So we're looking really carefully, and that's why our testing and our inquiry into any positive tests, especially around that overseas travel link, is very important.
Which positive tests came back this morning? Because those are the ones that you haven't been able to confirm are linked to overseas travel. Which part of the country were they from?
I don't have the exact details about that. I've just got the summary at this point in time.
How serious is the shortage of swabs for testing COVID-19?
We don't have a shortage of swabs at the moment. We're just making sure that we can continue to have both the swabs and other supplies needed to keep testing everybody who needs to be tested.
Auckland does not have a single community assessment clinic that's operational yet. What complications are you facing with establishment of these?
So the community assessment clinics are getting up and running from this weekend. Auckland will have 5, and then they're going to expand out further from next week.
Are tests being rationed?
No, tests are not being rationed. So 3 days ago, 620 tests were done. 2 days ago, it was around 750, and yesterday, just over 1,000 tests were completed. So there's no rationing. Yes.
What's the total number of tests you've done?
Oh, so the capacity, well, I don't know the total number, but the capacity that we can do at the moment is up to 1,500 a day. But again, the laboratories could work longer hours to do more tests if needed. It's important that we test everybody who needs to be tested.
But we're not doing 1,500 tests a day. Are you testing wide enough?
Yes, I think we are. If we see from the last 24 hours, we've had 11 positive tests. And nearly 1,000 negative tests. All of those would have been in people who had symptoms that could be suggestive of COVID-19 and had either a travel history or had a link to a close contact or a close contact of a confirmed or probable case, or where the clinician felt it was worth doing. So I think we are seeing quite wide testing, and that's helping assure us that we don't have any community spread yet. There was a question here.
Yeah, there are reports of low stocks of PPE. What's the ministry doing about this?
So we have plenty of PPE in the country, and I've talked before about our emergency supplies. The key thing is to make sure that we keep the supply chains going and we get that out to the district health boards and primary care practitioners that need it, but there is no problem with PPE supplies.
And can I ask about bars that you were saying that people are going to go out tonight? Do you think bars should be, a place should be enforcing the 100 people rule, or what's the etiquette there? While we know that the government is in consultation with the industry at the moment, but in the meantime, is there any advice to restaurants and bars for this weekend?
So I think the hospitality industry will be giving advice out to their members. There are ways that, for example, restaurants can do this by having shifts of people coming through, ensuring physical distance between people who are in the restaurant, and likewise in a bar. There can be a limit put on, and this often happens anyway in pubs or clubs late at night. They have a limit on the number of people going in. That limit will now be 100, and there are things they can and should be doing to keep people safe who are in there.
Some PPE
supply chains you've mentioned, are they functioning as sort of coherently as they should be? Because we're also getting reports from DHBs, a handful around the country, saying they just don't have what they expect they need.
We've got a really good stock take of PPE around the country, and every DHB says they have sufficient at the moment. What we are now wanting to make sure of is that we can continue the supply from our national stores to those DHBs.
Just staying
Are we
with
likely,
PPE.
going back to the bars point, are we likely to get to a point that you'd have to sign in to a bar or a restaurant so that people are then able to contact trace?
Well, I wouldn't want to speculate on that. I think what we can do is if there's a relatively modest number of people, less than 100 in a bar at a particular time, and we know there's a case who's been there, then that's a manageable number of people that we can reach out through all our channels to find, and particularly if they are close contacts. That's one of the main reasons why we've moved to that cap on the number of people for indoor gatherings.
How does
I know
panic buying?
that there is about 2 months worth of pandemic stock for New Zealand in terms of PPE care. The COVID-19 is a pandemic worldwide. Do we crack into that stock now, or is it up until there is a pandemic in New Zealand that we start getting through those supplies?
So we're constantly replenishing it. For example, we have our own factory in Whanganui that can produce masks at a rate of 200,000 a day. So just to put that in perspective, there are around 70,000 employees in district health boards across the country. So there's enough for, even if every employee, and that includes non-clinical employees, even if they were all using 2 or 3 masks a day, we have enough production for that. And we have the 18 million in our pandemic store. So at the moment, we're not necessarily needing to use it, but where we do need to, if a DHB maybe is getting low, then we can dip into that store and then replenish it.
How much
So if we
PPE?
look at ventilators, there was an article last night that said most of the ventilators in New Zealand are actually already in use. So is that true, and what can we do about that?
Yes, and so you would expect all the ventilators to be in use because they are people who are in intensive care or having surgery, so they're in theatres or post-op areas. We're just completing a stock take of all our ICU beds, all the other areas that could be turned into ICU areas, and the number of ventilators in both the public and private sector. That's expected later today, and we're sending it to ministers later today. Once it's been seen by them, we will make that publicly available.
How much
Are we
PPE
able
has
to
perished?
make more ventilators in New Zealand, or are you in negotiations with anyone trying to source more ventilators outside of, say, the public and private health, maybe looking at army bases? I don't know if they have their own stocks.
They don't, however, what I can say is we're looking at all the options. For example, one really good option is a lot of the newer ventilators have only just replaced older models. Those older models are still there, and we can repurpose those. They can be looked at by biomedical engineers and got ready to be used if necessary. As well as that, we need to train staff to look after people who are being ventilated 24/7.
How much PPE has perished?
There were 2 or 3 DHBs, I understand, where their stocks of PPE, particularly masks, were so old that the elastic had perished. That's been now replaced, and as I say, in terms of masks, we have good production here onshore, so that's helpful.
So South Korea's created an app where they can track cases. Any chances we're looking at similar technology here?
We are, and what I can say is we've had a multitude of offers from developers, both New Zealand-based and international, of all sorts of products, and we've just this week had a look at what are the sorts of things we might need, and we will be looking at all those ways that we can not just track cases and or contacts, but also support people in their homes so that they can get information that they need. So we're looking at all those
How far away could we be of creating such an app?
I think it's people who already have apps that they're keen to put into use. So it's just working out what it is we need and then which product it is that we might
Just
use.
to clarify, the number of people recovered from COVID, you can't yet say that exact number.
No, we don't. We haven't been collecting that information because it requires us to go back to, in fact, the clinicians looking after those people. But we're looking at how we can collect that and have it reported routinely.
In terms of the 11 new cases, is there any more information you can give us about those, or is that all going to be just on the website for people to look at?
Yes, it will be on the website because it's quite a number now each day. I don't have the detail, and I've been able to let you know the regions they're from, and the information will start to go up on the website fairly soon, particularly for those that were reported towards the end of the day yesterday.
Can we have some questions for Mr. Anderson?
Yeah, I've got a question.
So, okay, questions for Steve.
Hi, Steve. So I just happened to have a look on the online shopping today, and a lot of almost all of the segments were blocked out. Is there going to be any kind of like a triage for sort of people who are in self-isolation and really need the online delivery versus people just doing it for convenience?
As I said before, we're struggling in all parts of our business because of the high demand. So if everybody shops normally, then we shouldn't have those sorts of issues. But online has also been challenged in regards to the number of slots available. Key thing is plan ahead, and get back to that shop normal message.
Steve, any chance, are you looking at creating, overseas they have an elderly hour where the elderly can come and shop earlier or later? Are you looking at changing store times or allowing such a thing?
I'll talk on behalf of Foodstuffs in this one. We aren't looking at that. We've talked to Grey Power, and there's some social media talk about this, but Grey Power definitely gave the impression to us that elderly shoppers want to shop anytime. And what we want to do is keep our business as simple as possible and look after our customers. Because we're a cooperative, we've got individual owner-operators who know their community and often know their customers very well, so that's what we're going to rely on.
Obviously, this is the busiest time you've probably ever faced, well surpassing Christmas and, those Easter rushes. But are you facing troubles with, say, truck driver shortages and moving stock around the country? That's obviously a specialist skill. So what does that look like for you?
We believe we're okay in terms of truck drivers right now, but we are reaching out to logistics providers who aren't working right now in the forestry sector and the like. But we're just slightly above a Christmas week. Our biggest issue, so we can handle these sorts of volumes, but we plan for a long time for Christmas. The issue here is that it's arrived and it's unplanned. And as a result, my biggest concern right now, I think, is the tiredness of my teams. Really, really proud of what they've done, but they're getting really tired. So that's the be kind message. So hopefully people do that.
Would you be advising people to, go out and get a heavy truck driver's license? There's a lot of people facing job losses. Is that something that you'd recommend to fill some gaps?
Look, it's up to them. I really don't know about truck driving licensing, so I couldn't comment on that one.
Are we likely to start seeing sort of the one in, one out policy that some supermarkets have done?
Not normally. I've been through a number of stores yesterday, and there were some gaps in the shelf, but nothing. No, people talking about panic shopping. I don't think it's panic shopping. The panic shopping we saw was straight after some of their initial announcements, and that abated fairly soon. Now it's people just getting ready to self-isolate. So I don't think it's panic. It's preparation.
If people don't follow this shop normally guideline, are we going to face some kind of wartime rationing where, one family will be allocated this amount of rice for this week?
No.
Can I just make a final comment? And this is for the university students who might be wondering what to do this weekend. Mass gatherings indoors or large gatherings, more than 100 are not allowed. What I have seen is I read a very encouraging story today of a group of university students have already organised themselves to help out in the community, including with running errands, possibly doing shopping for people who can't go out. We saw the student army after the Christchurch earthquakes. This is the weekend when you can organise yourselves, of course in groups of less than 100, to be ready to help out in the community, and I'd strongly encourage you to take that opportunity. Thank you very much. We'll see you again.